And last but not least, in our discussion about diabetic complications, we have foot ulcers and infection. We've talked about how how these microvascular complications are coming about. So really all that's left to know is to kind of be able to recognize what's going on. So the foot problems are very, very common. This is probably one of the first things people do in their first clinicals and in their first rotations and first jobs. You're changing dressings on these kind of, the foot becomes a problem because it's the way it's used. It's it's on the ground where there's dirt, and you're putting a lot of pressure on it. It's very easy to step on things that might break the skin, and because you have that impaired sensation with diabetes, a lot of people will step on something and be completely unaware. One of the things that we encourage diabetic patients to do is a daily foot inspection and look at every angle in a mirror to make sure that nothing has happened during the day that they haven't caught. These can become very serious fairly quickly, and because of a diabetic's problem with wound healing and kind of issues with their immunization system, we have to be really, really fast about getting to these before they get into the point where it's going to become a chronic problem. It's the leading cause of non-traumatic amputation, meaning it's not a car accident or something's happened suddenly. This has been happening for quite a while. The plantar aspect of the foot, most common, meaning right exactly where this is here. Neuropathy really is the major risk. So these are the kinds of questions that do show up on exams, so make sure you know. We want to do a yearly foot exam, assess the foot daily. We want really good footwear that fits properly is really important. We do not wear tight socks. We don't want to affect the circulation any more than possible. Keep the foot warm and dry. We do not want any vasoconstriction. If you end up with, so we need to cut toenails in a straight line. That's another thing that I find shows up a lot as well. I'm just going to scribble it down because it's not here. Okay, so we're going to cut toenails in a straight line. And if any issues arise, you go to a podiatrist. You do not try to cut those toenails on your own. And again, we want to treat whatever injury has happened, very, very rapidly. They have this kind of picture, kind of down here at the bottom is just showing you one of the tests that you can do to test sensation. And I'm sure that you have used these in your health assessment class. I'm not going to go into it, and then I just found this lovely picture of this. Literally looks like it has just literally fallen off. It just died and went necrotic and fell off. It looks like these two are about to follow it. And it's incredible. Like, so much of that is just all of those kind of microvascular problems we talked about earlier. And then, very, very important, infection is incredibly common in diabetics. Diabetes causes problems with your inflammatory response. There's an impaired phagocytosis, which again, go watch the inflammation video if you can't remember what phagocytosis is. Soft tissue infections, for example, this turning into an infection is very, very common. UTIs happen a lot. We talked about why that is. Some people have very persistent glycosuria, meaning they have glucose in their urine all the time, and that glucose is an attractor to all kinds of different things, not the least of which is yeast. And again, you have a decrease in circulation due to that angiopathy, right? But then you also have a decrease in your immune response because of all this. Again, there's your candida infections, very, very common. Women are much more prone to yeast infections, unfortunately, but fungal infections, because of the love that yeast has for those hyperglycemic environments. Periodontal disease is very common as well. Really, that whole inflammatory response, if you remember, that chemotaxis, phagocytosis, all of that is depressed in diabetes. So not only are you not only do you have delayed wound healing, but you're at high risk for that wound becoming infectious. Diabetes management in a surgical client requires careful control because there's a greater risk of infection. I think this whole greater risk of infection is just a really, really important concept. And it's tied to the whole neuropathic, like lack of sensation, not being able to feel things. These two things together can have very, very devastating consequences. So I think that's it for talking about diabetes. Hopefully we've covered enough that you can pass whatever test you are studying for, and maybe swing back around when it's time to study for your NCLEX.